Mike Gibson, Steve Nicholls coming to you live from AHA 2024. And we're talking about a new drug, Muvalaplin. And this drug has a fascinating mechanism of action. Steve, as someone who has an elevated Lp(a), I'm very interested. Talk to us a little bit about what you found.
So most of the therapies that are being developed to lower LPA simply reduce ApoA production in the liver, and they're all injectable. Muvalaplin is the first oral LPA inhibitor to go to an advanced phase of clinical development, and it works in a different way. It simply inhibits the binding of that ApoB LDL type particle to ApoA. So you can make the ApoA, you just don't make the LPA particle itself. And in a phase 1 study at ESC last year, we showed that there was LPA lowering by up to 65%. Looked pretty encouraging with good safety and tolerability. Here at the AHA, we're going to report data in a much larger number of patients. These are patients high cardiovascular risk with a high LPA level.
And tell us what you found.
So we took 233 patients. They had an LPA greater than 175 nanomoles per litre. They had to have ASCVD, diabetes, or FH, so they were high cardiovascular risk, and they were treated for 12 weeks. And what we saw was that we saw LPA lowering by up to 70% using kind of the standard LPA assay, and by more than 85% using a new assay that we developed. And the importance of that new assay is that when you use the traditional assay that measures ApoA, then you measure ApoA on Lp(a), a little bit of free ApoA, but you also measure ApoA on Muvalaplin itself. And we think that's non-functional. So the new assay only measures the intact LPA particles. And so the ability to show that we've got LPA lowering by more than 80% is a really striking result for an oral drug.
The oral, half-life, daily dosing, what would it be done?
Daily dosing, safety and tolerability looks pretty good. And the other thing that we're going to present at the AHA is a reduction in oxidized phospholipids. And that's an important observation because we think that the oxidized phospholipids that are carried on those LPA particles really play an important role in the atherogenicity that we see. And
Interesting.
so we're going to report oxidized phospholipid reductions by more than 70%.
Wow.
With drug. And so all things look good. Obviously, we would need to move forward to a large cardiovascular outcome trial. That's the ultimate determinant of what happens here. But all things are lining up in the right direction here for this drug.
Exciting. I mean, there are just so many rapid advances in this area. Steve, thanks for sharing it with us. Thanks for all of us patients out there who have abnormalities in these lipids. And thanks to all of you for joining us here live from AHA 2024.